The relationship between sexual activity and overall health has become an increasingly important area of medical research, with studies revealing complex connections between sexual behavior and various aspects of physical and psychological well-being. Recent research has illuminated both the benefits of regular sexual activity and the potential health implications of sexual inactivity, providing valuable insights for healthcare providers and the general public. Cardiovascular health and sexual activity. One of the most significant findings comes from a comprehensive American study involving over 2,200 participants tracked across 5 years. This research demonstrated that regular and satisfying sexual activity correlates with reduced cardiovascular disease risk in later life. The connection between heart health and sexual activity extends beyond direct causation, suggesting a complex interplay of physiological and psychological factors. The cardiovascular benefits of sexual activity appear particularly noteworthy among older adults. Research published in the Journal of Sexual Medicine has identified strong associations between sexual inactivity and various cardiovascular risk factors, including diabetes, elevated cholesterol levels, and hypertension. This relationship appears bidirectional, as a 2023 Italian study found that cardiovascular disease patients reporting sexual dissatisfaction also experienced diminished physical well-being. Mortality and long-term health outcomes. National Health and Nutrition Examination Survey, NHANES, data has revealed intriguing patterns regarding sexual activity and mortality rates. Among married patients with hypertension, those engaging in sexual activity less than 12 times annually showed higher all-cause mortality rates compared to more sexually active counterparts. These findings suggest potential protective effects of regular sexual activity against various health conditions. A longitudinal study published in the Archives of Sexual Behavior provided particularly striking results. Men who reported decreased sexual desire at the study's outset showed a 41% higher likelihood of developing chronic illnesses and a 63% increased risk of cancer during the 4-year follow-up period. The impact on self-rated health was equally significant, with 47% of men and 64% of women reporting worse health outcomes associated with reduced sexual activity. Immune system function and sexual activity. The relationship between sexual activity and immune function has gained renewed attention, particularly in light of recent viral health challenges. A 2021 study revealed that individuals engaging in more frequent sexual activity demonstrated enhanced immunity against COVID-19, while those having sex less than 3 times monthly showed increased susceptibility to viral infections. The physiological mechanism behind this immune boost involves sexual arousal and orgasm triggering responses similar to acute stress reactions. This process elevates levels of adrenaline, noradrenaline, and prolactin, consequently enhancing immunity through increased production of leukocytes, including natural killer cells and specific T lymphocytes. Psychological health and sexual activity. The psychological benefits of sexual activity extend far beyond momentary pleasure. Regular sexual activity serves as a natural stress management mechanism, with recent studies demonstrating improved sleep quality and reduced anxiety levels among sexually active individuals. A 2023 American study notably found that recent sexual activity correlated with better sleep patterns and reduced symptoms of post-traumatic stress disorder. The relationship between sexual health and sleep proves particularly significant, with research indicating that 53.8% of women and 22.7% of men experiencing insomnia also report sexual dysfunction. These findings suggest a complex interplay between sleep quality and sexual health that merits careful consideration in clinical settings. Body image and self-esteem. Sexual activities' impact on self-perception and body image represents another crucial area of study. Research consistently demonstrates positive correlations between regular sexual activity and improved body image across various demographic groups. A particularly illuminating study comparing transgender and cisgender individuals found that sexual intimacy enhanced sexual esteem and body image perception in both populations. Debunking common myths. While the health benefits of sexual activity are substantial, some commonly held beliefs lack scientific support. For instance, the often cited claim that sexual activity burns hundreds of calories proves largely exaggerated. Research indicates that a typical sexual encounter of 6 minutes duration burns approximately 21 calories for a man in his 30s, only marginally more than watching television. Similarly, the notion that sexual abstinence enhances athletic performance lacks scientific backing. Recent meta-analyses indicate that sexual activity within 24 hours of exercise does not significantly impact aerobic fitness, muscular endurance, or power output. The concern among some athletes about protein loss through ejaculation also proves unfounded, as the approximately 250 milligrams of protein released can be easily replenished through normal dietary intake. Clinical implications and healthcare considerations. Healthcare providers should recognize that changes in sexual activity patterns, particularly decreases in desire or function, may serve as early indicators of potential health issues. However, this relationship likely works both ways, as individuals in better overall health may naturally engage in more frequent sexual activity compared to those facing health challenges. Age-related considerations. The impact of sexual activity on health appears to vary with age, requiring healthcare providers to consider age-specific factors when discussing sexual health with patients. Older adults may experience different benefits and face different challenges compared to younger populations, necessitating tailored approaches to sexual health counseling. Future research directions. While current research provides valuable insights into the relationship between sexual activity and health, several areas warrant further investigation. These include the long-term impacts of various patterns of sexual activity, the role of relationship quality in mediating health benefits, and the potential development of interventions to address sexual health concerns in various populations. Practical applications. Healthcare providers can use these findings to inform their approach to patient care, recognizing sexual health as an important component of overall well-being. Regular assessment of sexual activity patterns and concerns may help identify potential health issues early, while open communication about sexual health can support better patient outcomes. Conclusion. The relationship between sexual activity and health encompasses multiple dimensions of physical and psychological well-being. While regular sexual activity appears to offer various health benefits, the absence of sexual activity should not be viewed as inherently harmful. Rather, changes in sexual activity patterns may serve as important clinical indicators, worthy of attention in comprehensive healthcare provision. As research in this field continues to evolve, healthcare providers should stay informed about the latest findings while maintaining a balanced, evidence-based approach to sexual health in clinical practice.